pain ongoing, chronic pain after day. Whether it's a nagging pain in the neck or a constant stabbing in the back that limits mobility, no one wants to be afflicted by pain. And so when I put the glasses on, it's night and day different with how it changes my vision. But if you tested my vision right now, it'll be 20/20. In October of 2017, I fell ill with meningitis that quickly progressed to encephalitis and spent, 3.5 months in the hospital. Upon getting better, we realized that all of my senses were scrambled, and we knew that my vision was off as well. We kept seeing eye doctors, and they would tell me my vision was 20/20, but I knew that it wasn't, that something was off. And then we found a physician in Houston who worked at the VA hospital with soldiers and said that the injury I had was very similar to how soldiers presented after blast injuries with PTSD. And that physician had just recently read The Ghost in My Brain and was able to connect us with Dr. Zielinski. The biggest thing that Dr. Zielinski does is push the limits of science. She takes what she knows and what she understands about the brain, about the eye, theorizes what possibility could be there, evaluates all of her patients individually, and then combines all of that knowledge together to assess what she thinks the underlying problem is. I like that she bases her reasoning in science, she bases it in math, and then she comes up with an individual result for each patient. And I know that people ask, why can't this be taught to every eye doctor across the country so that the same results can be seen? And a big part of that is it's the way that Dr. Zielinski thinks, it's the way that she approaches a patient, that you'd have to have doctors approach their patients in the exact same way, where they're wanting to provide that individualized care, they're wanting to rise up to the challenge of figuring out what's going on. And it felt very validating that finally all the problems I was noticing were being recognized by a physician. So she made me a believer very quickly, and then I had to convince my colleagues and my friends and my physicians back home to also become believers in it. We're all, students. As physicians, you're lifelong students, and appreciating the limits of medicine and how much further medicine has progressed since we graduated from medical school. Particularly what we know about the brain, what we know about the eye, and how they work together, and how our senses are so much more than just our 5 senses individually, that they all intercross and work together. And when something goes wrong in one, it impacts all of them.